Welcome to Peter's Principles, a show dedicated to changing your life through proper nutrition and exercise. Today's show is dedicated to the most important muscle in the entire body, your heart. Did you know that 330,000 people die each year in the United States from sudden cardiac death? And it doesn't really need to be that way. See, while I'm speaking, someone just lost their life to cardiovascular disease. The statistics are mind-boggling, but heart disease is one of the most preventable diseases on the planet. There are so many risk factors that we ignore. What I want you to do is gather your family and take notes, because this show just might save your life.
That particular day, luck was on my side. If I had been on the small
David Cohen is talking about the day he died. Yes, that's right, died. David was at a football game in Seattle, Washington when his life changed forever.
I went into cardiac arrest and just sort of caved in.
Two doctors saw what was happening.
One came and did CPR on me, and the other one banged on my chest, and so EMS defibrillated me, sort of brought me out of it.
He was rushed to the emergency room where doctors discovered he had a blockage. David will never forget that horrifying day in Seattle.
After I realized that, as the doctor said, I had died at 5 o'clock on the 8th, that scared me more than anything else.
What is even more frightening is the person sitting next to you right now could die from heart disease. It's the leading cause of death among men and women in the United States. But what is heart disease? What's most troubling is it's one of the most preventable diseases. The key to prevention is knowing and cutting out risk factors, which include smoking, high cholesterol, diabetes, and high blood pressure. That means exercise and proper nutrition. But where do you begin? When it comes to taking care of the most important muscle in your entire body, your heart, you need to be disciplined at the breakfast, lunch, and dinner table. According to Harvard University, as well as the American Heart Association, they're saying you should have more fish in your diet. It has everything to do with omega-3s. Research shows omega-3 essential fatty acids can help decrease risk of arrhythmias, which can lead to sudden cardiac death. They decrease triglyceride levels, decrease the rate of artery clogging plaque, and can slightly lower blood pressure. The best source of omega-3s come from fish. So how much should you eat? A new study found people who ate about 11 ounces of fish per week reduced their risk of an irregular heartbeat by almost 30%. It's recommended patients without history of heart disease to eat fish at least twice a week. Patients with heart disease are advised to eat a couple more servings a week. For those people who do not like fish or are not getting enough omega-3 fatty acids from their foods, they could try supplements. I personally take Rescue 1250. It's an omega-3 marine oil with pharmaceutical grade EPA and DHA formulation. But remember, always consult with your physician before taking any supplements. Pick up some tomatoes the next time you're at your grocery store, as well as bananas, if you want to lower your risk of heart disease. Reason being, it has everything to do with potassium. Potassium can help prevent or lower blood pressure and reduces the risk of stroke. It also helps regulate your heartbeat. How much do you need? About 3,000 to 4,500 milligrams a day. Do you shake salt on your food? Stop. Salt can increase your risk of heart disease. It can worsen symptoms like swelling and shortness of breath and cause weight gain. Best advice? Toss the salt shaker and check food labels closely. Many foods already contain a lot of salt. Speaking of DASH, the DASH diet is one step to lowering high blood pressure, which can reduce your risk of heart disease. DASH stands for Dietary Approaches to Stopping Hypertension. Dieters need to eat more fruit, vegetables, whole grains, fish, poultry, and nuts. Cut back on foods high in saturated fat, like red meat and sweets. There are tons of benefits. The DASH diet lowers artery-clogging cholesterol and homocysteine levels. It promotes bone mass and helps you lose weight. Hopefully these tips will keep your heart healthy for a long time. What is the best source of omega-3 fatty acids? Is it A, fish, B, yogurt, or C, eggs? The answer is A, fish. Foods enhanced with omega-3 such as eggs, vegetable oil, cereal, yogurt, and milk won't give you as much of the omega-3 fatty acids as you think. Your best source is fish. It's packed with omega-3s, full of protein and low in saturated fat. As I've said for years, the most important muscle in the entire body is your heart, and we need to take care of it. Research suggests that you may be able to get your heart in shape faster with interval training, which combines sprints of intense exertion alternating with low-intensity recovery periods. Interval training may make it easier for your heart to maintain the intensity for the entire workout. But the most important thing when it comes to your heart is a well-balanced game plan. Always work in concert with your doctors. If you're on medicine, have your doctor and cardiologist determine your training heart rate zone. Make sure you wear a heart rate monitor. Tell your personal trainer, and always warm up and cool down, and never ever jump off the treadmill to answer the phone or doorbell. Sudden stops will put a tremendous amount of stress on your heart. And avoid the Valsalva maneuver. That's when you hold your breath. It's pretty exciting when you can take knowledge and implement it correctly. Like Patrick is doing. He's exercising. He's got his program. But maybe someone alongside him is exercising and just goes down with a heart attack. What does he do? Saving a life could be in the palm of your own hands.
Stay calm. Follow these voice instructions.
This device could be your guardian angel, your saving grace if you collapse suddenly of a heart attack. This life-saving device is an automatic external defibrillator.
The AED is capable of shocking an irregular heart rhythm and hopefully establishing it back to a usable rhythm that the body can then sustain itself.
Charles Hughes owns Advantage First Aid. He has dedicated his life to saving lives and training people in CPR and how to use an AED.
Firmly place the pad without the liner on the patient.
Charles trained the staff at my clubs how to use the device.
All gyms, fitness centers, and companies that deal in fitness, they are now required to have a defibrillator and trained staff on site.
But AEDs are highly recommended for all public places.
Do not touch patient. Analyzing heart rhythm. Please wait.
If you have an AED and somebody goes down with cardiac arrest, you can treat them on the spot before EMS gets there.
Rob Cutler is a sales manager with Cardiac Science Corporation, who manufactures and distributes these AEDs. They have more than 200,000 devices in 55 countries around the world. The devices are exceptional because they're so easy to use.
The only thing that a person will have to do is place the pads onto the patient. The device completely takes over.
The pads show you where to place them. A voice prompt will tell you if the patient has a heartbeat and needs CPR or a shock. You don't even have to shock the patient. The machine does it all.
Press red flashing button to deliver shock.
Studies show average response time for EMS is 8 to 12 minutes. Patients have a much higher chance of surviving the quicker they are treated.
Shock delivered. It is now safe to touch the patient.
Every minute that passes by, a patient actually loses about a 10% chance for successful resuscitation.
The devices cost about $1,300 to $1,500. A small price to pay to save a life.
It's one of the best feelings that you could ever get.